is Paul Higgit. I'm the Senior Engagement Lead for Healthwatch Walsall. We're commissioned under the Walsall Together programme to gather the views of patients, carers and families and citizens. So this is a case study that's come across conversation that I've had with a member of the Occupational Therapist team at the Palliative Care Centre. So a young lady has been diagnosed with cervical cancer not too long ago. Is known to the GP, has been receiving care and support through the hospital, but was referred late to the CNS team, referred late to occupational therapy. So the young lady has a teenage son at home. Was finding it very difficult to get to the toilet upstairs. So in terms of toileting, in terms of her dignity, it was having an impact on her son's psychologically as well. So the lady was unfortunately having to crawl upstairs to go to the toilet. Was also having to use or sleep downstairs, or find it very difficult to get upstairs due to breathlessness. So due to that late referral, the occupational therapy team attempted to try and get a stair lift in place. And that's the whole key role of the occupational therapist team, is to get some of these elements in place to support people with choice and dignity of life in that respect. So the occupational therapist team, if knowing about this case, would have been able to have the equipment in place earlier to support some of the symptoms and some of the difficulties the challenges that mum was facing. They were able to get the equipment in place to give that choice and dignity to mum. But some of the difficulties and some of the challenges to face, which I'll read out to you, is that potentially the lack of education around the role of occupational therapy and physiotherapy from other professionals in relation to palliative care may have been some of the difficulties and challenges that have been faced. Knowledge of the existence of the role of occupational therapy in the palliative care and when to refer into, to have that earlier conversation with the patient and the family. The lack of confidence of some professionals outside of the palliative care team. So these aren't Healthwatch's views, these are the views from the occupational therapy team. And this story itself has already gone to Walsall Together Board as one of the case studies. So some of the conclusions or recommendations that have been put forward have been education about the promotion of the role, early intervention pathways, understanding the need to prepare for the decline through conversation and intervention to avoid risk, and patient education awareness of the role, so it's patients understanding what is the role of palliative care, but also the role of occupational therapy. And then what's obviously being done at the moment to support some of this work is an educational programme which has been delivered through the district nursing team. Plan for 2020 to roll out education of the role to other colleagues across the acute and community, and potentially repeating for the new community nursing staff, and also targeting adult social care in relation to what this role provides, and forging closer links with community colleagues in intermediate care to ensure that referrals go into the right service at the right time.